Hey everybody, it's Mama Deb, and we're here with Mama Deb Gets Real about mental health. And today we are going to be talking about medical traumas. And before we get into the meat of the broadcast, I want to give everybody a few seconds to show up and get comfortable. So I hope everybody's doing okay. Hope y'all had a really great week since the last time I saw you. Um, Sorry if y'all can hear fan noise in the background. It is 106 degrees. That's right, 106 in Oregon. Frickin' frackin' fruck, something's broke because it is bad. It is bad here. All right, y'all. So when we're talking, I want to set the record straight from the very get-go. So when we're talking about medical traumas tonight, I have a special guest that's going to be joining me. We're talking about the place that medical traumas start, which is at the home. When parents don't listen to their children, or one parent invalidates what a child says about their health, and they just say you're making it up or you're doing it for attention. That's where medical trauma starts. Okay. And now when we're talking about it continuing through the cycle of getting your child help or getting yourself help, we really do have to land some of it with our medical community. But I want to go on record, you guys, absolutely want to go on record that the vast majority of medical professionals are there to serve their patients. They do the job to the best of their abilities each and every day, and they take care of their patients. There is a very small amount of medical professionals that do not do what they're supposed to do. And it all starts with their bedside manner, okay? Because bad bedside manner is the major accounting for medical trauma. And what do I mean when I'm saying bad bedside manner? I'm talking about belittling the patient, treating you like you don't know your own body. I'm talking about not having the patience to sit and listen to your patient's comments, concerns, and questions about their own health. Playing down your patient's concerns like it's no big deal. What we have to remember is that it is a big deal. To that patient, that stomach ache is a big deal. That's why they're in that office. Okay? They do not listen, and they steamroll their patients. What I mean by steamrolling is they say, this is what we're going to do. You have any questions, comments, or concerns, as they're walking out the door. That does not allow for the patient to actually air their questions, comments, and concerns. And the last thing before I introduce my guest, I have to remind all of you, okay, that doctors, we don't work for the doctors. We don't work for the medical professionals. The medical professionals work for us. Our insurance company works for us. We pay them to do a job. So when you are talking about being your own advocate and avoiding medical trauma, that's something you need to absolutely write down, remember, and take to heart. Because if you remember you're the one in charge and it's okay to ask questions and to advocate for yourself, you're going to find yourself in a much better place as far as getting medical care that is satisfactory to you. With that being said, I'd like to introduce my special guest for the night, Marcel Geek. And we are here to talk about the problems with medical trauma. Good evening. Yes, it is evening. Good evening, Sadie. How are you?
Good night.
Yeah, good night, right? So, how are you doing tonight?
Good.
Good. So, you want to start? You want to start us out, or do you want me to? Because I think the place we need to start is where it starts, which is in the home with our parents.
Yep.
So, why don't you lead off?
So when I was younger, my dad had remarried and I had a stepmom, and I had always had issues with food since I was born, pretty much. And when she came into the picture, there were times where I was forced to sit and eat food until I was throwing up at the table. And so that's where some of the trauma started, with feeling like I'm a hypochondriac, or I'm just making things up, or like not validating. Like I was literally like throwing up at the table trying to eat food that my body couldn't eat.
So did she actually say you're being a hypochondriac, or did she just make you feel like you were
making things up?
Oh, you're making things up. Okay.
Mm-hmm. Or like, oh, she just thought I was being like picky, like a picky food eater, which I was, but with real reasons. Like,
I can hear it in my head, hearing you say, "Quit being so dramatic. Just eat your dinner."
yeah, I
You know,
remember sitting and eating, her trying to get me to eat potato salad. Until this day, I can't eat anything that tastes like potato salad. Not deviled eggs, not egg salad, anything like that. I'll,
mhm.
I can't even smell it. Like even now, like it's very triggering.
I'm not trying to downplay what you're saying, but I just had a joke pop into my mind where I'm like, yeah, I'm that way with tequila. I can't have nothing to do with it, but for obvious, different reasons. But
Yeah.
continue. I'm sorry.
And so, I think that fueled a lot of my like some of the problems that I have now, like with when doctors don't believe me. Like it stemmed from there. Like, and I remember even being in foster care as a child and being forced to eat the food for 3 days because I wouldn't eat it the first day. They would just keep reserving it.
Oh,
And
that's
I just remember,
gross.
and I remember throwing up at foster care too because I couldn't eat it, and I would eat it because I was hungry and I wanted them to just like let me eat something different, so I would have to eat it anyways, and I would be like throwing up
Mm.
in the middle of the night, and it was always in the middle of the night, sick.
How do you think that affected your self-esteem? First off, I mean, when they're telling you you're faking it, you're making it up, all of that stuff, that's got to have a very traumatic effect on your self-esteem.
Mhm.
You had to have no
Yeah,
belief in yourself.
yeah, and like even to this day, I'm constantly looking for validation. Like I'm even studying my own disease so that I can validate some of this because like I know there's things that even the doctors don't understand.
Well, no, and just to go on record with it, what is it? What is actually your disease process, if
So
you have it?
I have an eosinophilic disorder, and most likely that's not really the true diagnosis. I most likely have mastocytosis,
Can you
but
say that one more time? You're a little bit. It was a little bit soft.
mastocytosis,
Okay.
hence the mast cell geek.
Yeah, that.
Yeah, so that's most likely the real diagnosis, and I've had a couple of doctors say that they believe that's my diagnosis, but they won't do the testing to prove it. So I'm just really frustrated about that. So
Let me guess. Let me take a just ballpark guess here. Is the testing expensive as all heck, or is it difficult to
it's
get
just
at, or
very
something?
invasive.
Very invasive. Okay.
Mm-hmm. A
So do
bone
you
marrow
feel?
biopsy.
Do you feel? Oh God. Oh, bone marrow
Mhm.
biopsies are very painful. Sadie, is that actually something you're at the point where like I
That's
need
the
this
only way
diagnosis?
to verify is by
Okay.
having a bone marrow biopsy. And the thing with this disease is a lot of times it's often later diagnosed. So it's
Okay.
like, what can we do to change that? Can we like start testing people earlier so they're not getting to the point where you're so severe and that's when you're going to test them instead of waiting until like there's a major problem.
Mm-hmm.
And you do it when they're sicker. It's more risky to do it when somebody's very sick than to do it when you can catch it and
So
prevent it.
it sounds like to me that you have become an advocate for this disease, for your disease, and you're
Yes.
trying to educate not only just everyday people or people who might have it, you're actually trying to educate the medical community through your research
Mhm.
and make life easier for other people who come before you.
Yeah. And
And
another thing that happened when I was a child is going swimming at Lake Superior.
mhm.
Um, Going in the cold water would make me sick, but they back then they just thought I had heat stroke from the sun, but I was actually getting sick from being put in the cold water.
Hmm. And so that they went with this. Well, and I don't think that that's actually a wrong way to go for per se with the doctors who
Yeah,
initially treated you.
it wasn't
But
doctors, it was my parents, but, like, back then they didn't know about cold urticaria. Like, well, they did, but, like, it was
yeah,
rare.
but exactly, that was what I
Yeah,
was just going to say. It was a rare disorder. It wasn't something they saw every day. So it was like, honestly, I know that sounds terrible, but I think that it's the stuff that doctors back then were writing papers about to get it out there,
mhm,
and because I had actually not heard of your disease process until I met you, and I had to go back and look it up, and then I had to talk to another friend of ours to get myself educated on it because I had no
mhm.
idea what it was.
Yeah,
And I'm a 25 year paramedic, so I've seen a lot, but I had no idea what you were what you were talking about.
The funny thing is like a lot of the medical myths, we break those myths. It's like,
Well, but that's the point, isn't it?
It's normally a medical myth, but for us, it's not. Like,
yeah, because you're in research now, and that I have to applaud you, Sadie, because you're taking the place of what you felt is in power or being not validated, being pushed down, being pushed aside. Now, as an adult, you're really validating yourself and validating your feelings and going forth and making a huge difference for people with this disorder, because you're finding the root cause in what you're doing. And it's not like you're taking the easy route, honey. I looked into your schooling. Holy cow. You have a lot of schooling ahead of you, and you're a mama too. You got all this stuff going on. So I applaud you 100% for taking control of the trauma that was caused to you and the mental health problems that you have because of that, and taking control and saying, I'm done. I'm now going to be me. I'm going to be Sadie, and I'm in charge of my life. Yeah. And that's a huge step, girl. Now, was there therapy involved to get to that point?
Yeah. And yep, there's been a lot of therapy, but there's been a lot more trauma.
Yeah. No, let's continue talking about it. Absolutely.
Yeah. So then after I got older and I had my kids, the trauma, I dealt with a lot of trauma around my youngest child, medical trauma.
Okay.
Parent. She was born 5 weeks early. I had pretty bad preeclampsia. And she was only 3 pounds, 14 ounces at birth. So she was very tiny.
Very tiny.
We didn't know that she had a lot of health issues. And probably the reason why she did come early was because some of that. Like, and then because I was basically probably allergic to progesterone, but didn't know it. And so my body was reacting to the pregnancy. Yeah.
Okay.
She actually wasn't. Later on, I found out she should have never lived. She should have been stillborn, because there was like tons of blood clots in the placenta. The placenta was only 10% the size that it was supposed to be.
Holy crap!
So when she came, I'm just glad she's here. Like,
I was just gonna say, so instead of looking at it like, having a premature baby is one thing, but I don't think she qualified as a micro preemie, but I might be wrong, but I don't think she did.
She actually didn't need any interventions except for the first day or so. She had to be in that heat, but then after that she never was on oxygen or anything. Because she was 35 weeks, even though she was small. She was developed.
Dude, you got yourself a little fighter right there, don't you?
Yeah.
I think she's destined to do some pretty great things with her life after fighting that battle. So did they think that the problems that you were having at the time of the pregnancy caused her low birth weight, or is there
because there was blood clots, so there wasn't good blood flow to her.
Okay. Well, that makes sense.
So they ended up inducing me, and she was so small. We didn't think she was that small, because I was measuring for her to be at least 7 pounds, but she was only 3 pounds 14 ounces. So she was really small. And my oldest was less than 6 pounds at a week overdue. So my babies are just really small.
So you produce some small babies.
Yeah.
Okay. Yeah. But still, 3 pounds that's actually quite scary. Do you think that you were probably see, my medical mind goes to, you were measuring as she should have been a 7-pounder, but she wasn't getting the nutrition that she needed from your placenta and everything. So that is
water weight. I had a lot of water weight.
Okay.
Because of the preeclampsia.
Oh.
I was swollen.
We could do a whole nother show about preeclampsia. It's such a joy.
Yeah. And so then after she was born, she just had trouble eating and gaining weight. And so when she was 4 months old, the doctor's let's get more calories into her. And so we started putting rice cereal in her bottle.
Okay.
And she, within 2 hours, was vomiting and lethargic and going into shock.
Oh, so that was not the thing to do, but it is actually.
So I took care of a baby that had Hirschsprung's. So my first instinct, she wasn't was to stimulate her. So I would give her a suppository, and that would clear it. And I didn't know till later that actually saved her from going into shock because it like messes with the heart rate when you stimulate the
Yes, it
rectum.
does.
So like
Yes,
it would
does.
reverse it. So I didn't realize that that's what I was doing, but I was actually saving her. And then like a couple of times after, so then like the next time I was like, okay, there's something wrong.
Mm-hmm.
So I took her to the ER, and they're like, oh, she's fine. She probably just has something viral. And like, I felt like every other day we were going to the ER for the same thing. And then I realized, okay, there's something going on with the rice.
Yes.
So we switched to oats.
Okay.
Same thing. And so then we started researching rice and oat allergies and found this like tiny little group of moms on Facebook that all had kids with the same problem, and learned later that it was food protein induced enterocolitis. And so we had to pull all food and
And have to start over again, huh?
see her, that's it.
Okay.
And then I was like eliminating dairy from my diet so that, and things like that, to try to like figure out what other things might be triggering it. That's one thing that moms will do, is they'll like eliminate food from their own diet.
So just to clarify, when we have a child who is failure to thrive, like yours was, it is pretty common to introduce something like a rice cereal or something like that. But I can already hear it.
She was kind of eating formula here and there too, not a lot.
Well, but she was primarily breastfed.
And then but then like I noticed she would throw up all the time when I fed her formula, so I stopped doing that, and later found out dairy was like the biggest culprit. But we didn't know until later. And then when she was we just pulled all grains, and then later we started introducing like simple fruits and stuff. Or like she's like the kid that I actually started feeding eggs sooner than they say, because it was a good source of protein. And like peanut butter. Like we
put a little weight on her
before she was a year old, because we just wanted to get something high in fat into her. Like, I don't recommend that, but like later I found out Israelis do it, so I was like, let's do it. The allergist was like, let's try it, because like higher,
See,
here's the calories.
Here's the thing: when we're talking about situations like that, I can already hear what's going to be happening in those ER visits that you took. The ER or nurse or physician, and it is standard. If I was that nurse or physician, I would be saying, whoa, time out. She's not even 4 weeks old. What are you thinking doing that? Well, my pediatrician told me to. Okay. So, then I can see as a new parent, and you already had one. This was your second one, correct?
Yeah.
But I could still see as a parent with someone who has these special needs coming up, that how awful you would be made to feel when somebody goes, wait, whoa, that's not the right thing. And with the eggs and peanut butter, I can see the same thing happening. It's just when the allergist and the other doctors got on board and said, no, this is what we have got to do for this child. But I can see where your trauma is coming from, because you felt totally invalidated. It's bad enough as a mom, you cannot keep your kid healthy, and you feel beat down that way. But then to have somebody say something like that to you would be just as bad.
And then we couldn't find a doctor that, like, we knew what problem she had, but we couldn't find a doctor that would believe in it.
Oh, no. Okay.
Nobody believed in FPIEs. Now there's like an organization, and it's more nationally known. So now it's like, and like I was at the infancy of this disease with those families.
Okay.
And so then we started like when she got to like 9 or 10 months old, she was still like 8 or 9 pounds. She was so tiny. She was wearing 3-month clothes when she was a year old.
Wow. That's okay. We'll just say hi to your roommate going through.
So actually, I lost my train.
That's okay. Let's ask the obviously need to ask question here. How is your daughter today?
I need to finish what I.
Okay, I'm sorry. Go ahead. I'm sorry. Go ahead.
So at about 10 months old, we finally found a gastroenterologist in Minnesota that recognized it, and so we got help. And then at 2, we were in the mountains in Pennsylvania and realized there was oats and some cookies, and she did fine. So like 2 years old is usually when they start reintroducing those, because it's like a T-cell thing where they the T-cell memory is only 13 to 18 months. And so we started we were going to do an oat challenge, but then we accidentally gave her cookies and she was fine. We're like, thank God, because we were in the middle of the night, Pennsylvania, driving home. And then rice was fine, but like dairy was like the biggest trigger. And then at like 3, she started having some issues with disaccharides. And so like she's always been failure to thrive. Even now, she still has trouble. And so we're still trying to figure out what's going on. Probably same thing as me, but like we don't know.
So you're still trying to figure out what because this is the thing I think it's really important that people understand. There might be 2 people standing next to each other that have the same disease process that Sadie's daughter does, and they will not be reacting exactly the same way. The body is so individualized. So what works for Sadie's daughter may not work for John's son. Okay.
Yeah, and then when she was 7, she ended up in the middle of the night. We woke up to blood everywhere in the bathroom.
Okay, that's horrifying.
And she was having a GI bleed.
Oh my God.
From dairy. So we took her.
You gave me goosebumps right there.
We were in and we were in Texas, and we had a really good gastroenterologist that was like knowledgeable with FPIEs, but his boss was on call that week, and he was a complete ass.
You could say ass. It's okay. And say it loud and proud, because if he did not treat your daughter,
and even the nurses were like, he's being an asshole. Like everybody, even the nurses knew that I was right and he was wrong. And I knew it was dairy because we were trialing it, and she was 7. So the gastroenterologist said, go ahead and try it. We were putting it in baked goods. We weren't giving her straight up dairy. We were doing it like baked, like if it's like an ingredient and something, allowing it.
Okay.
And then she woke up in the morning with a GI bleed. We took her in. She also has Ehlers-Danlos syndrome and autonomic stuff.
Okay.
Which is another big thing that triggers CPS.
Oh yeah, I was just gonna say. So when did CPS get called on you guys?
When she hit puberty, and we needed to have some stuff done.
Wow.
I got called on over an IUD.
Oh.
Yeah.
I'm not really sure where I need to go with that, because I'm so torn. I'm gonna venture a guess to say that the doctor you requested the IUD from was the one that activated CPS.
No, the pediatrician.
The pediatrician did. Okay.
The doctor that was going to do this IUD was my OBGYN, and she was fully on board with it. We were going to do it, and the pediatrician is the one that called.
Okay, so now
it wasn't medically necessary.
So now you have a daughter that you've been dealing with all of these medical problems with, and you're educating yourself the whole way through the process, because you need to be the biggest advocate for your child.
And we had just been at Mayo Clinic. We had a tilt table test, and so we had verification that she did have orthostatic intolerance.
Okay.
And that's something that's very common with the Ehlers-Danlos syndrome. She was diagnosed by a geneticist, and I had released medical records to this clinic multiple times, and they never went followed up to get them. They never even they could have just called to verify that they were legit diagnoses.
Oh, absolutely.
And I handed her the phone multiple times so she could read the medical charts from Mayo Clinic and other places to verify that these were legit diagnoses, and we were just at Mayo Clinic and validate it. And she called CPS because of the IUD, but then she added in the other things, even though they were.
So, what was she trying to prove, Sadie? Was she trying to say you had some type of Munchausen's or something? Yeah. Or what was she trying to prove?
She's trying to say I was pushing procedures on my kid.
Wow.
Even though a cardiologist is the one that referred us to Mayo Clinic. And my kid hadn't even been in the hospital since that time when she was 7, and now she's 11, and we're finally dealing with some stuff.
Okay.
Puberty, it pushes POTS kids over, and then being isolated for 2 years with
COVID and everything.
With COVID, and when she, not being sedentary, during that time, because they're doing distance learning and she wasn't moving around as much, it was making it worse.
Oh, I'm sure.
And so I was about to have surgery myself, and her dad and we had talked about sending her to Texas because then she could go to school in person, and we knew that she needed some physical activity. Regardless of the pandemic, we would rather send her to school And this COVID, then keep her home anymore because it was just being sedentary. It was like not.
It was compounding the problem.
And then because CPS was called, I couldn't send her there because I couldn't let her leave the state of Minnesota unless I wanted Texas to get involved in the CPS case, which I was not going to let happen because it was over an IUD.
Yeah, I have a headache now just for you. I have a headache for you. I can't imagine because you're doing what you're supposed to be doing. And you did exactly what every parent should do. And you went to the right clinics, you saw the right doctors, and those doctors agreed, and those doctors like, yes, 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 yes. And then you run into the pediatrician who has no bedside manner, thinks because she's never heard of it, it's not possible, and blows off everything and every other good doctor that you have in your daughter's life and says, you're a child abuser because you're doing child abuse by proxy.
I was a week out from having my own major surgery. And so I'm stressed out when I'm supposed to be calm because I'm going in for surgery myself. And I needed my child to go to Texas to be with their dad while
so
I was
you could have the surgery, right?
Yeah. Yes. And that CPS case, because I was in CPS as a child with foster care, that triggered a major panic attack. And that's when I called and got therapy.
Oh, well, thank goodness.
Because like I was like, I can't do this. Like I called and I was like, I need somebody now. Like therapy.
Wow, sis.
Like, and
wow,
that's what started the therapy, and it's been probably like life-saving for me. Like it pushed me to go back to school.
So you have come to the realization that you did nothing wrong for your child. You just wanted the best for your child, and you pushed, and you found that one doctor was going to be a horses behind me about the whole thing. Well, the two doctors, the ER doc and then the pediatrician.
Yeah.
So how are you doing now, though? How's your daughter doing?
With her, we're still trying to figure things out, and now we can't get the doctors to the new pediatrician. We thought she was going to be really good, but she's still hesitant to like refer us. And my kid was in the hospital for 3 days needing fluids because of not getting the therapies she needs for her disorder. And I'm not like trying to get extra stuff. I'm like just physical therapy or like something because she needs it. But
basic things that she needs and I'm like, to
well, she doesn't feel comfortable treating her orthostatic intolerance. Well, then can you please refer me to a cardiologist
that will?
Yeah. She's like, no. I was like, okay, then what am I supposed to do? And I haven't seen this pediatrician since because like that started the CPS thing has made it impossible for us to get care for anything else.
Yeah, and plus, Sadie, if you do your due diligence, you're like, okay, I'm done. Refer me to somebody else. She refuses. You start shopping pediatricians. You're going to get a bad name for shopping pediatricians. They're like, look what she's doing here. Look what she's doing there. And I do understand why they do that because it does show a pattern of possible abuse.
Yeah.
But in your case, it's not the abuse. You just need somebody to listen and get the referrals to what you need.
Before the CPS case, I kept her medical records squeaky clean because like I kept them clean, like with very specific doctors, like not staying away from those that might flag us, like the doctors. There are some with this disease where you want to make sure that the doctors you have are credible and well known, and that really affecting our care now. Like
I can only imagine.
And then my own health issues, like when we found out like she was going through all this food stuff at 3, I didn't realize how sick I actually was because I was so focused on her that I was missing myself. And it took her allergist to look at me and say, I think you need to go to the doctor yourself, because she started taking our family history and she's like, I think you have eosinophilic esophagitis, because
you're like, oh,
history I was telling her. And that's the first time I ever heard about this disease.
Okay.
But then when I read about it and stuff, it made sense. So I went and got scoped. And at first I didn't get diagnosed. It took 4 years or 3 years from that time to get diagnosed because the gastroenterologist in Minnesota wouldn't biopsy for it.
Oh.
I had hallmark esophagus for it. Like I was having impactions. I had rings, furrows, like.
And he just, what was his
esophagus, but they wouldn't do the biopsies to verify.
What was his rationale for not doing the biopsies?
Well, the first doctor, because in Minneapolis it takes a long time to get in, because I had seen a gastroenterologist as a teenager, my doctor or the allergist said, go to Duluth and see the doctor you saw. And he's really good. He did do what he could, but like they don't know that disease there, and you have to have a pathologist that can read it correctly.
Okay.
And so, but he did find that I had Barrett's, and so I had that taken care of because that's precancer. So I came back to Minneapolis, and there's a doctor that treats it, but he would not acknowledge the fact that I could have EOE, and he's an esophageal specialist. And so I had him, he took care of the Barrett's, and I was having impactions, like food getting stuck.
Yeah.
Like, I have EOE and I need to like get dilated and things like that. And so then in the meantime, we moved to Texas, and I needed my 6-month follow-up post the Barrett's to make sure that all the cells were gone. And so I went to a gastroenterologist there, and then I was finally diagnosed.
Okay, so you did finally find. Yeah. I'm curious though, how does because here in the United States we are a for-profit medical, which really sucks because insurance companies rule, and they rule what our doctors can and can't do. Did you find that you were having a whole lot of problems with insurance companies?
No.
None at all, huh?
No, because I've always had, because of all of the issues that we've had, we've always had the highest level of health insurance that you can get, which is usually the best.
But which is probably a really great idea, especially for you and your family, given everything that was.
So I have platinum healthcare because it costs me a lot. I barely see any of my paycheck from Starbucks, but I need it. So
but you need it, yeah.
You need it.
Yeah, and that has to be, and that's another thing I really want to point out is that it is unfortunate in this country that the people who can most benefit from good healthcare coverage can't afford it. And it's all because of pre-existing conditions, stuff like that. Like I can't afford the best healthcare. My husband recently switched jobs, and to stay on COBRA coverage, I was going to have to pay $600 a month for me and me alone to have insurance until he passed the 3-month mark. And I was like, I can't. So I had to go out and get private insurance, but I pay for the best insurance, but it's still less than $600 a month, Yeah, but it makes no sense. It makes no sense to me because where's the continuity of care? When you're having patients have to do that, where is the continuity of care? Where is everybody? Where are these patients going to get their medical charts? I've already ordered all my medical charts. I would walk them in myself if I could, but they don't allow you to do that. They have to mail it to the doctor or fax it to the doctor. And I swear, Sadie, I don't know if you find this, but I find that every time something goes wrong with it, every single time, they either don't fax the complete records, or they fax it to the wrong place, or they mail half of it, or something goes wrong. And they wonder why patients get irate and say, hey, I want to walk my medical charts over there. And technically, they cannot stop you because they are your medical charts, but they sure don't like you to do it. They sure don't like you to do it.
Yeah. And so then once I got diagnosed with EOE, I'd already been to a couple conferences, met people, like the specialists. So then I started going to Chicago because even in Texas where they diagnosed, they were not up to date on the treatments for it.
Okay.
So then I started just going to Chicago, and I knew exactly who I was going to see, because I already knew them. So I was already going to conferences because I knew I had the disease.
And you found the best people to treat you.
Yeah, and I had done a little internship in Chicago with somebody, and I was helping them with some of their histology. So I had lots of discussions with people about this disease, and so I just went there. And
well, I have to applaud you, Sadie, because you've done the one thing that I found myself now doing, because I was recently diagnosed with rheumatoid arthritis. And I applaud you for educating yourself. I applaud you for going out of your way to make sure that your child has the best and gets exactly what they need. Because as you and I both know from both of our parents, not all parents are willing to do that, or not all parents are willing to listen to what's going on in their child's body. Because that's what they need from us, honestly. The people who are supposed to protect us and love us and take care of us when we're younger, sometimes they don't. And that's horrible because it sets us up as for adults for all of
Mhm.
this trauma. You just go into it and you're believing, well, I'm going to go to the doctor with this. You know,
Yeah.
for example, my mother, I said, Mom, there's something wrong. I can't walk. I can't run. My knee hurts. It just hurts. Oh, it's just you're working out too hard. Oh, you're just, this is my favorite. You're just looking for attention, Deb.
Mhm.
Well, I ran a cross country race and hit a pothole and I tore out all the ligaments and stuff in my knee. I had to have all of it redone. But she kept me, I didn't get my surgery until not 6 months, I'm sorry, 6 weeks later because she thought I was making it up. That put me in a place where I'm like, I'm afraid to say anything because I don't think that I'm right. I think I'm going to be belittled like I was by my mother. And that's exactly what happened to you as well. You felt like you were going to be belittled and you finally, I honestly believe, and you guys can pish pot me all you want, but I believe that your daughter came to you for a reason too.
Yeah,
You
and
had your daughter for a reason.
the trauma was like with my kid was I learned very quickly that you can't walk into the emergency room and be hysterical with your kid because you
Nope. Nobody will listen to
So
you.
I learned very quickly how to hold back my emotions and be objective with my kid. I can be objective with myself and just get through it. And so I never dealt with those emotions that I needed to deal with as a parent. Like I would be the one that would put my kid down and I wouldn't even feel it.
Yeah.
Because I knew she needed it done, but and so I just had to get her through this stuff to keep her alive. So my whole thing was just to keep her alive, and my motto was like, don't mess with Mama Bear because I will eat you.
Yeah, no, and it's true. And during that time though, when you had to be so strong, your mental health took a hit.
Yeah, and when she was dealing with all that stuff, when we realized that that some of the stuff that she was dealing with was coming from me, I said, you're not going to do one more test on her until you find out what's wrong with me.
Yes.
When you find out what's wrong with me, that's going to give you answers to help us figure out what's going on with her.
And that is the honest to God truth.
I believe that to this day. Like that's like
no, because genetics play a very big role in looking into what can possibly happen. Why do you think all healthcare professionals ask for your history? What's your family history? Do you have this, and this disease? Do you have diabetes, cancer, MI, strokes, all of that in your immediate family circle? If the answer is yes, then it's something that they need to be considering. And like I said in the very beginning, the vast majority of medical professionals are doing their job and they are looking out for those things. But it's when we get people who are like what Sadie experienced with the ER doc who just wasn't ready to listen, even though the kid was having a GI bleed, and the pediatrician who just didn't want to listen or doesn't want to refer her. She knows what's best for her kid, and that's where what I said before is we have to absolutely 100% remember doctors work for us. We don't work for them.
Yeah.
If they want to leave you and you're not satisfied, you need to say, hey, come back. We need to continue having a conversation. And if they're like, I don't have time, then you need to switch a doctor. Okay. We all know that. Sadie and I know that very well.
Yeah.
And that's the first step to stopping medical trauma is taking charge of your own care. Now, don't get me wrong. I'm not saying doctor yourself. I am not saying that by any way, shape, or form. Okay.
Interview your doctors. Interview your doctors. Make sure that they fit for you. Make sure that they're knowledgeable in your disease. If they're not for you. And don't
feel bad about it.
Like to make you think that once you see them that they are going to tell you what you need to do in XYZ, but until you hire them, they are not your doctor. You are there. Your first appointment should be an interview. Treat it like an interview.
And what Sadie means by that is literally like a job interview. Because whenever I had a really good rheumatologist who diagnosed me. Now I have a fairly crappy rheumatologist who I interviewed. And they said, well, you just need this. And I'm like, I can barely make a fist some days. How is that going to help me? They're like, we're going to cut back everything and start all over again. Oh, no. Not having that. So I said, thank you for your advice. I appreciate it, but I think I'm going to interview another doctor. And he was completely offended that I said I was going to interview another doctor. But it's my health, my body. I have the right to do that. Now, you don't need to be disrespectful and yell and scream at them, call them idiots, whatever. That's not what we need to do either. Because we just need to foster an adult conversation between two adults.
Yep, and there was times when I just, 2 minutes into an interview, into an appointment, I just looked at him and I said, you're not the right one for me. And I've gotten up and left. And I've been polite about it, but I'm like, I'm sorry, but this is not going to work for us.
Yeah, thank you for your time, but this is not going to work for me.
I'm not going to spend 10 more minutes there if I already know that it's not going to work.
Oh, absolutely. And that's that's one of the things that was really important that we talk about is that we advocate for ourselves.
Mm-hmm.
Because if you have, for example, my children, okay, I run the genetic lotto not when it comes to genetics, okay? I got the arthritis, I got the rheumatoid arthritis, I got the degenerative, oh my God, my discs are going to hell on my back. I have the mental health disorders. Well, all three of my kids have mental health disorders. And the first thing they did, and I told them, I said, I know you're grown-ups, but if you want me to come to that first visit or be on the phone, please let me be there for you because I will tell them all my history and they'll be like, oh shit. So when we finally did that with my daughter, because she's like, I'm a grown up, I don't need my mommy. But when she finally did let me do it, I started talking to the doctor a little bit. The doctor's like, okay, I'm pretty sure your daughter's bipolar. And I'm like, I might be sure. When she told me that again, I was like, oh, honey, I'm sorry. I feel it's my fault because I passed on those genetics to you. And they're still actually now debating whether she actually is bipolar or it's just an ADHD or what it is. They cannot seem to get two doctors to agree. But at least there's a conversation going on about what can be done to help her. And that's what I think is important.
Mm-hmm. Yeah. Something I've gotten good at.
So now, Sadie, how is your oldest daughter?
I think I started advocating for myself when I was in my 20s because I had Graves' disease. And so I ended up having to have a thyroidectomy. But that,
oh, wow.
Like at that stage of my life is when I had to really start advocating for myself.
Mm-hmm. And I think that it takes something big like that in order to do it. And my best friend was always advocated for herself. Was really good about advocating for her own children. She was amazing. She told the doctor, "No, there's something wrong with my daughter." She was 22 years old, and she's like, "No, you're going to check her." Well, she ended up being diagnosed with thyroid cancer at 22. That does not happen. It doesn't. And Shannon was very good about advocating for herself and her children, but in the end, she ended up having back surgery, and she did not advocate hard enough for herself because she was like, I need to be on a med surg floor because I have all of these god awful allergies, and they were awful. Mm-hmm. But when they said, here's the floor you're going to be on, she said, this isn't med surg. This has to be a cardiac unit. I have to be on a cardiac unit, not med surg. They put her on med surg with no cardiac monitor whatsoever. She ended up throwing a pulmonary embolism and dying. And that's an extreme case, but that's where it is so important that you advocate for yourself. And just because you mentioned it to one person doesn't mean it's going to the second, third, and fourth. So mention it to every single person you come in contact with along the way. And if they get annoyed with you, then they are not the medical professionals for you. Okay.
I had one doctor tell me that I had $1 million workup because I went to Chicago for my care, and I was trying to find somebody local that could manage it.
But you couldn't find anybody.
The first time I went in for a scope, the anesthesiologist looks at me and he's like, we don't see very many people with that disease. I'm like, you didn't make me feel very confident in the care that you're going to give me.
Yeah, thanks, Doc.
Okay, so if you guys don't see this, please count, what's the pathologist do? They know how to diagnose this when they're looking at the slides. I'm like, you didn't make me feel very good about this. And then, so she scoped me and she said I didn't have enough eosinophils or something like that, or that they were low. But now I'm like, but then later I was like, I don't know if I believe that. And so then after 6 months, she had me come back in and I was supposed to get re-scoped. And the day of my scope, I looked and there was a different doctor doing the scope. And I called them and I said, I'm not coming in.
No, because that's not the doctor.
I'm not going to have somebody that I don't know scope me. I'm not going to waste my time or my resources.
And that is absolutely.
I called them, called Chicago, and I made an appointment there because I was like, I'm just going back to Chicago.
And that's absolutely 100% within your right to do that.
At that time, the $100 airfare was worth it.
Yes.
Then to spend couple thousand searching for a different doctor.
No.
So logistically, it was just cheaper to go to Chicago.
I absolutely agree with you on that, and I do. And the other story, I think you and I have talked about this actually quite in depth because we both have some pretty horrific medical things happen. Yeah. And again, I'm not saying this is all doctors, but it took them probably 3 years to diagnose me with a latex allergy, and I was a paramedic at the time, and I damn near died a couple of times. But the one time that I did end up on a ventilator, I remember, and I remember totally, them pushing, they're getting everything ready because they're going to intubate me, and they're pushing the succinylcholine and God, I'm blanking the other drug, but and I remember hearing the nurse say, "Hey, doc, you want to wait a few more minutes, a few more seconds? It hasn't taken effect." And he said, "She won't remember it anyway." Well, hello, doc. We are 20 years later, and I still remember it. Okay, so it's that kind of stuff and that kind of blasé attitude that is what causes this medical trauma. Like I truly, we all know who I'm talking about here, but I could never see our friend who is studying to be a doctor treating another human being like that ever. He's going to be the best doctor, and I just know it because he is a great human being.
And I know exactly what you're talking about because I've been sedated and choked on the scope because I wasn't out. And I told him, you guys got to give me something stronger because I'm not doing this.
This is not happening here.
No, like choking on a scope.
Mm-hmm. No, it's the worst. It's the worst feeling in the world. I remember just feeling him tilt my head back, and I remember feeling the laryngoscope go into my mouth, and I was like, oh my God.
Yeah, there's been a couple of times where I've been awake enough to know that I was gagging on the scope.
Oh, yeah.
And I'm like, you need to give me more next time because
that ain't working. Oh, look here. Here's a good one. LF brings this one up. I had the exact same thing happen to me. Fat shaming. I had it happen. Okay. Now, y'all know I'm not shy about this. I'm a big gal, okay? I'm 5'2". I weigh 186 pounds, okay? But the fact we're going to put in here is that I used to weigh 300 pounds. And I had back surgery, and then I got the bypass done, the gastric sleeve done. And then now 13 years later, from the first back surgery, I go back in because now I have narrowing of another disc, another area. And my doctor says to me, you've already had one back surgery because you blew out your back because you're fat. So why don't you try losing another 20 or 30 pounds? Then we'll do the back surgery. And I then turned to him, and you guys all know how I am. I'm a little sassy. And I turned to him and I said, exactly how would you like me to do that? I can't exercise. I can't walk for more than 5 minutes a day because of the amount of pain I'm in on my back. He goes, why don't you try a diet? I got up. I walked out and I reported him because I've never been, after I stopped crying, I reported him. I've never been so shamed in my entire life because of something because some guys, and I felt like looking at him going, hey, listen, you're no skinny mini Porky Pig, but that's not who I am. So it's what I wanted to say.
That's but, like, I've dealt with a lot of food issues since I was a kid. Like up until recently, I couldn't tell the difference between hunger, anxiety, or stomach pain because they all feel the same.
No, exactly. To me,
I couldn't lose weight because I wasn't eating enough to boost my metabolism to be able to lose weight.
And that's actually
on a diet was not the right answer because I could go for like half the day without even eating.
You know, the thing is also is like I ended up going to a nutritionist. Somebody said, why don't you go to a nutritionist? Then you can tell them, you know, the next doctor. And I went to a nutritionist and they told me the exact same thing. You're not eating enough. I was actually starving because I wasn't eating enough of the right foods to keep me where I needed to be. And, you know, for a doctor to just assume that because you're a large person, you're fat and lazy, it's
you can still be
irreprehensible
and be fat.
Yeah.
And inflammation holds a lot of fat. It does not hold a lot of water weight.
Yes.
Just having
I'm sorry, I was just gonna ask you, Beck, can you bring up Purple's comment for me? Huge fibroids. Yeah, that'll do it. That will do it. And
yeah, I had a lot of issues with that too. And I had a hysterectomy, and that was like the big thing that allowed me to lose weight was having the hysterectomy because I had so much inflammation from being allergic to my hormones that I couldn't. I was, if you looked at pictures of me before, I was 50 pounds heavier, and it was all water weight, mostly all water weight.
And it doesn't help matters because every time you have an allergic reaction, you get all poofy, you get all that irritation, you get all that inflammation.
And I was on steroids all the time.
Yeah, me too.
To stop the allergic reaction. So the steroid.
Hey, Purple, can you put a comment in on the chat there? I want to know what happened with her. Did she turn out okay? And then, hey, Beck, can you pick up OA's comment about her child? I missed it. I wanted to read it. So just so while he's doing what I just asked him to do, okay, I want to give a real big shout out really quick to my producer Beck. He keeps me freaking sane, y'all. He is very good at what he does, and I cannot say enough nice things about him. Let's see, 3 months old, hospitalized for 2 weeks. It was a half. Holy crap! That. Oh wait, I hope they figured out what was wrong with him. I wasn't. Oh no. Oh my gosh. So did he thrive with the formula? Oh wait, I'm curious if he. I'm assuming that he is. I know that you have a couple youngins, so I'm assuming that you actually had. That is one of them. There we go. So back to Purple really quick. She said that her partner had to have a complete hysterectomy. Yeah, you know, they might have Purple. They might have. Because you never know, like, when it started. There's always going to be that guessing game. And it always actually, then it attacks your thought process. And when you feel like you're going to be, you feel like, okay, am I seeing things wrong? Am I feeling things wrong? You know, that's what starts to affect your mental health. Mm-hmm. You had the wrong doctors show up to your appointment, Wolf. That is awful. Oh, God. I think I would have gotten up and left too. I'd have been like, oh, I'm sorry, wrong doctor, bye-bye. From the doctor that I'm supposed to be, then they walked in. Oh, that's lovely. Okay, so here we go. He had to go on feeding tubes for 9 months of his life. Oh, wow.
We were able to avoid the feeding tube at 2. She was just a few months shy of 3. And we had to go to all formula because she was just reacting to everything. Like,
oh my gosh.
She had disaccharidase deficiency, and it was because everything was blunted in her duodenum, so she couldn't digest anything.
Oh, that makes okay.
So we had to put her on formula Neocate, which is like $50 a can.
Yeah, it's expensive.
Minnesota, it's not covered by insurance because they are like they don't have to pay in Minnesota. So we literally survived through a back alley group of parents that had their kids on it, and then they didn't need it, so we would just buy it
from them.
Shipping. We survived for 6 months.
Wow. So yeah, OA. I'm hoping that the feeding tubes did what they were supposed to do, and now he's a healthy, wonderful little guy or girl. I didn't see which one it was. I apologize if I'm going the wrong sex with that. And Purple, yeah, it does make you wonder, doesn't it? Because I had fibroids that I had them removed, and it's amazing how much better I'm doing now. Just
later, I found out that my grandma actually lost a child at 18 months to something similar.
To what your daughter has?
Back in the 40s, they didn't know how to treat shock. They didn't know about shock in kids. They just died of failure to thrive.
Yeah, exactly.
She went into shock and died.
So really quick on Wolf there. They say something about the blood test having to be redone. You know, when I was first diagnosed with latex allergy, you actually there was no standard test in an allergist's office because it was back in the mid to late 90s. And they actually had to send it out of state. And when they sent it out of state, guess what happened? The results got lost. I was positive for a latex allergy a good 6 months before anybody figured it out because something happened with the test. It was just a complete and total debacle. But I can understand that is very, very frustrating. You know, you go in there, you think you have you're getting an answer, and they're like, "Oops, we forgot the test," or something. And I know, human beings, we all mess up, we all make mistakes. But I can understand why it's very frustrating on the end of the patient because I've been there, I've been on that end, and it can be very frustrating. And I'm so glad to hear he's doing great. I'm so glad. Sadie, what about your girls? How are they doing? Are you doing better now?
They're doing okay. My youngest still does need care.
Mm-hmm.
But I'm gonna get it.
That's right. I was just gonna say she got a mama wolf on her side, and
I've already been talking to somebody that's going to see her. So
excellent. I'm so happy to hear that. You know, I really am because it's been about 54 minutes, so we're going to start wrapping up. But what I want to, first off, Sadie, thank you so much for coming on and talking about this with us because it is a real thing that as people who have mental health, issues, or even if you don't, having a physical health problem and being given the runaround or not being given what I would call sympathetic care, just being there, being the person that's going to hold the hand and just listen to me for 5 minutes is all I'm asking. Having that happen, you can create mental health problems. And I think that the most important thing, like I said in the beginning, is we have to learn how to advocate for ourselves, and we have to don't remember not to be afraid to ask the questions, because some of them may set you free. And initially, when I found that quote, I was thinking about all these mental health issues. But now I'm talking about mental health and physical health, because if there's something wrong and you feel like there's something wrong, say something. Get to somebody who will listen to you. And if they keep saying there's nothing, go find a therapist and talk to your therapist. And maybe you will learn how to explain things better, and your therapist can help you with that, so that you can get to somebody who is going to give you the help. Because I always knew there was something wrong with me from the minute I went through puberty, and it wasn't until I was 17 or 18 that I got diagnosed with major depressive disorder. And that was 2.5, 3 years, where I was like thinking I was effing crazy and thinking about killing myself all the time. So don't give up on yourselves. It's so important. I know some days are so hard and they're just hard to even get out of bed. But remember, you take the little wins: getting out of bed, getting in the shower, getting dressed. That is a win. Those 3 wins for one day, okay? Treat yourself like you matter, because you come here and you matter to us. We all show up every week and we talk about these things and we support each other. And, Sadie and I have only been friends for just about, 6 months now, I think. And you know what? I would stand by Sadie's side if she needed somebody to back her up and fight for her kids. I would do it. And that's why we have these streams and these channels, so that we can do that for each other. So remember, knowing yourself is the beginning of wisdom, and of all wisdom. And know yourself, fight for yourself, and advocate for yourself. Please, please, please join me in the after party if you like. But in all things, remember, be kind to yourself, and you're perfect just the way you are.